You're tuning into BDI Weekly, the official podcast of Best Doctors Insurance.
Este es el programa de Best Doctors Insurance.
Here, we discuss the best in health insurance.
Los temas más interesantes de salud médica.
Medical mysteries, diagnosis, and world topics.
Best Doctors Insurance. A inovação e assistência médica.
Good morning, everyone. Buen día a todos. This is the official BDI podcast, el programa oficial de Best Doctors Insurance. And we're ready to start a brand new episode. Un episodio completamente nuevo y muy importante. On the show today is a highly regarded professor of microbiology and infectious diseases at Nova Southeastern University, Dr. Bindu Mayi. Thank you for being here.
You're very welcome. Thank you for having me.
Absolute pleasure. I wish it was under better circumstances. I know that the subject matter for today is quite serious, and hence why we wanted the absolute best voice on the subject. That subject is coronavirus. We're going to discuss this worldwide pandemic. I wish I could say epidemic. It's a pandemic at this point, and it has taken thousands of lives. Estamos hablando del peligro mundial, el coronavirus. If you have an opinion or a question, contact us at bestdoctorsinsurance.com. Tienes un comentario, contáctenos en la página de web. Dr. Mayi, again, it's a real honor. You're one of the leading voices on the topic. It's horrible what's happening. You have come to us at a time where people are in great fear. People are afraid. They're not sure how serious it is, how serious it could become, and what to do about it. And it doesn't matter who you are, all walks of life, everybody's focused on this. And we're going to obviously, explore all the facts and everything that you know. But I do want to be fair and obviously, share a little bit in your background. I know that you're an author of a book, a great book called Mrsa. It's a compelling multi-generational narrative about staph infections. Can you tell us a little bit about that?
Certainly. I wrote this book about prevention of Mrsa. Mrsa is a bacterium that can kill at the very worst, but it can also amputate. And the reason why we amputate a Mrsa infection, someone with a Mrsa infection, is because you try to cut off the limb to save the rest of the person. So it's a bad bacterial infection. However, prevention is extremely easy, and yet people are unaware of it. So what I've done in this book is use storytelling to educate people about the prevention of this really horrendous bacterial infection. It's easy to do, but if people don't know about it, they're not going to do it. And the book itself is about a young boy who's bullied and turns his life around with the help of a mentor. So one of the principals in North Miami told me that several of her middle schoolers had never read a book cover to cover until they picked up my book. And they were so inspired to read after that they couldn't stop checking books out of the library.
Wow.
So it's serving
nice.
multiple purposes.
Multiple purposes, right. So it's tackling bullying and at the same time, this horrendous staph infections.
Correct.
Wow. And you're also, of course, a spokesperson on like one of the leading voices, again, on subject matters, not only coronavirus, but Zika virus, sepsis, and flesh-eating bacteria.
Correct.
Wow.
Several different infectious diseases, essentially.
Wow. And how did you start your very accomplished career?
It's all I've ever wanted to do, really. I was quite the nerd. I knew at age 13 that I wanted to go into microbiology. And I had a twin, and both of us wanted to do this. She ended up passing away.
Oh, I'm sorry.
Thank you, Willie. Right before we turned 16, actually, she was in a fire. And she had second and third degree burns. And the irony and the beauty of all this is when someone succumbs to burn, it's essentially because you are getting rid of a very formidable barrier, which is the skin, and the person then ends up getting a lot of infections. So I think it's perfect that I'm so focused on prevention of infections, and I didn't even connect the two until I'd written my book, actually,
Wow.
and then started getting feedback.
They say that there are no coincidences, right? But it's amazing that, you lost your sister and somehow it somehow paved the way for your career because it served as a foundation. Because then I guess you realized that you wanted to help others.
It's my driving force.
And it shows, I've seen you, on the television. I've read many articles, and it seems like you're always trying to be at the forefront, when it comes to this subject matter, and it can only be to help, and I appreciate that.
Thank you.
So I'm sure that many other people appreciate that, as well. Again, right now is a pivotal, moment, in the world where we just don't know, what's going to happen next. And that's of great concern. So since that's on everyone's mind, obviously, can you explain to us, can you just break it down for us in layman terms, if you will, what is coronavirus?
So coronavirus, as the name suggests, is a virus. However, it belongs to a family of viruses. So until this new virus came along, there were 6 members of this family, 4 of which just cause the common cold. That means it only infects our upper respiratory tract, nose, maybe the throat. So that part of our anatomy. And then we have symptoms of the common cold, coughing, sneezing, etc. And then we get better. 2 more dangerous members have been the Sars Coronavirus, which happened in 2002-2003, and it caused pneumonia exactly like this virus is doing, which essentially means the lung is now finding it difficult to do its job, which is gas exchange. It grabs carbon dioxide from our blood and dumps oxygen into the bloodstream, which is very essential for us to live. So in pneumonia, what happens, that gets compromised, and so people aren't able to breathe well. So when people were succumbing to SARS, they were succumbing because they couldn't breathe anymore. So the kinds of help we give in hospitals include supportive treatment, which is let's help them breathe, and let's keep all of their vitals stable. The other virus that was also dangerous was the Mrsa coronavirus, which is the Middle East Respiratory Syndrome virus, which is a problem in the Middle East. And unlike SARS, which went away because of public health measures we put in place all over the world, MERS is still kind of percolating. It's not, there aren't as many cases as this new virus. However, it's still kind of in the background. The new virus, so all 3, SARS coronavirus, MERS coronavirus, and the new virus, they all cause pneumonia.
Wow. So it's a respiratory.
Correct.
Really deadly virus that strikes your respiratory system.
Yes, it strikes the respiratory system. It isn't as deadly, and that is good and bad. Good because it's not really killing a lot of people. Bad because when it's not as pathogenic, then it's able to spread in the population. So what's happening with this new virus is we are seeing asymptomatic transmission. That means people are contagious before symptoms become apparent. But based on just the numbers, the explosive spread of numbers we've seen in China, and now it's picking up in South Korea and also in Italy, I'm fairly confident that we are also seeing something called subclinical infections, which are also contagious. That means these individuals have the infection, they have absolutely no symptoms and won't have symptoms. However, they are still spreading the virus.
Wow.
We've seen that with other viruses in the
Right.
past, so it's not a surprising thing by itself.
Right. And is it true that it originated from an animal?
Yes.
A snake, a bat, or
So coronaviruses have, these infections are zoonotic infections, and they're not the only ones that cause that. That means these viruses are present in the animal kingdom, and then so we get them either from birds or our contact with animals. So all of the coronaviruses are found in bats. Bats are the reservoir. So they carry these viruses without being sick from them. So the SARS coronavirus came to us via a cat-like mammal that was considered to be a delicacy in southern China where SARS coronavirus originated. So people bought these animals at live animal markets, slaughtered them, consequently got exposed to them. The virus underwent a mutation in humans and then spread human to human. MERS coronavirus came to us via a camel. So there's an intermediate host. That means a host that we are more likely to come in contact with that has picked up the virus from bats. And then we come in contact with these intermediate animals, with these intermediate hosts, and then we get exposed to them, and now we carry the infection. So in the case of the new virus, we think there's an intermediate host called pangolin, which is considered to be, it's outlawed to hunt or eat pangolin. However, there's probably still illegal trafficking going on. So the theory is that pangolins have been the intermediate host in this new coronavirus scare that we're seeing.
Wow. I mean, so everything originates from these animals. So in a perfect world, if nobody would eat these animals, then we wouldn't have these.
Right. So yes and no, Willie. And the reason for that is a lot has to happen. A lot of things have to align properly before we actually get the infection. So, for instance, I'm sure we get exposed to things all the time, but our immune system fights it off. So let's say in a setting where our exposure to these animals are higher, greater, in some parts of the world where these wild animals may be picked for their meat or for certain parts of the body that's used in ancient medicine, whatever the case may be. So when that potential for exposure goes up, there still has to be enough of an exposure, for instance, or enough of a downtime for our immune system for this virus to now find a footing and go gangbusters in the body. Wow. And then that person also has to be in a social setting where he or she can now spread the virus to others. So a lot has to happen before the virus can really gain that foothold. So there may have been multiple, it's called a spilling over from the animal kingdom to the humans. So there may have been multiple spillovers before conditions were absolutely right that now it can take off and arrive.
So it's really a perfect storm of conditions.
Right.
I mean, and have to align.
Right.
And it's sort of unbelievable. You know, when I think of it, it's like...
It's nature.
It's mind-blowing.
Yes.
I mean, I don't even know. So... is washing our hands often and all these things that we do sort of often?
Absolutely.
So it does help.
Yes, and hand washing helps us with all kinds of infections. So it's a very good... I tell my students, don't touch your face until you make sure you washed your hands, because we are creatures of habit, right? At the end of a long day, if you're used to touching your nose or rubbing your eyes or putting a pencil in your mouth or a pen while you're thinking, you are going to do that regardless of where you are, whether you're in a clinic seeing patients or in a crowded bus in a crowded city, you will do that. So it's a good rule for all of us to follow, because we are in that kind of a setting now. There are enough of us, and enough of us harbor all kinds of infections. Right. But it's a good idea to make sure our hands are clean before we touch our faces. Yeah,
so you see, that's a common thing that we hear, and now to hear it from you, it makes it that much more important. So, we should be doing that. What about cooking, like eggs and meat and things? I mean, is there any variable effects?
Yes, absolutely. We don't know that for this coronavirus. Eggs or meat don't seem to be an issue for this coronavirus, but it is for other infections. It's a good rule to make sure that the eggs are boiled appropriately or cooked appropriately, or the meat is cooked enough to prevent certain infections, certain GI illnesses.
Wow. And traveling. That this is why we're in the mess, right? It's really traveling. One person goes to another person in another part of the world. They infect the person, and there's an incubation period.
There is an incubation period, yes. Willie, I think we are in an age of globalization, right? A person can, exactly like this virus, a person can pick it up on one continent and in 48 hours or less be on a completely different continent and now has the potential to spread the virus. That can happen at any time. What's working and what needs to continue to work is a system where we have ongoing surveillance of these new infections, surveillance of re-emerging infections. These are things that were an issue in the past and then weren't and potentially could come up again, like Zika did. So these surveillance systems are absolutely essential so we can identify when there's a new outbreak going on and then immediately put public health measures in place.
Right.
Billy, I also wanted to mention the importance of cough and sneeze etiquette, especially as it pertains to the new virus, but also when we talk about influenza, because we are still in the midst of influenza season. So coughs and sneezes will dispel particles that carry these infectious virions. And if we trap them, if we trap the cough and trap the sneeze into a handkerchief or a tissue, then we prevent these droplets from going out into the air around us, from where they can potentially infect other individuals who are vulnerable to these infections. So all of us in every country in the world needs to make sure that we have proper cough and sneeze etiquette, because that is a very effective way for us to stop these viruses from going out into the air, from where they can infect surfaces, from where they can be inhaled by somebody else and potentially come down with it. So it's important for us to do that.
Wow. Kids are the ones that have to do better doing that. But we have to take a break. And there's no one better than you to cover this subject. So very honored again and happy you're here. We will be back shortly. Ya regresamos. This is the official BDI podcast, el programa oficial de Best Doctors Insurance.
You are tuning into BDI Weekly, the official podcast of Best Doctors Insurance.
Este es el programa de Best Doctors Insurance.
Here, we discuss the best in health insurance,
Los temas más interesantes de salud médica.
medical mysteries, diagnosis, and world topics.
Best Doctors Insurance, a inovação e assistência médica.
Willie Bermudez, back with you. Aquí seguimos con la doctora Bindu Mayi de la Universidad de Nova, Professor of Microbiology and Infectious Diseases. Well, we're covering coronavirus, and as you had mentioned earlier, you are a spokesperson and an expert on the subject and other subjects as they pertain to infectious diseases. So if we compare Zika, sepsis, and other flesh-eating bacteria, how would you describe the spread rate compared to coronavirus?
So all of the infections you mentioned, they are different infections that you get in different ways. Sepsis and necrotizing fasciitis, for instance, it's dependent on the individual and the individual's immune system and whatever else is going on with their system, if they're compromised in some way. Zika comes to us by the bite of an infected mosquito, and then the infected person can turn around and either pass it on to another mosquito that then bites another person and gives it to them, or they can pass it sexually, by sexual transmission, or by donating their blood, and then it's also by bloodborne transmission. The new virus is primarily transmitted by aerosols and droplets. So the infected person coughing and sneezing dispels infectious viruses that piggyback off of these cough and sneeze particles. Then susceptible, vulnerable individuals can inhale these particles and then come down with the illness. These cough and sneeze particles can also land on surfaces and contaminate the surfaces that someone else can come along and touch. So if you don't have good hand hygiene, you can now touch your face, your eyes, nose, or mouth, and subsequently get infected. In addition, Sars Coronavirus was also transmitted by fecal matter. So if someone is changing diapers on someone who has diarrhea, which in the case of SARS, some of the patients also had diarrhea, and then they don't have good hand hygiene, they now can infect themselves and other people. The new virus, there are some patients who also seem to have diarrhea, and with the new virus, we know that it's also found in fecal matter, and we think it's found in urine. In the case of SARS, even sweat was contagious. So when someone has pneumonia, they have high fever, and then they have chills and you're sweating, that sweat itself was also highly contagious. We don't know yet if the new virus shows that, but it's primarily by respiratory aerosols and droplets that we inhale.
And what would be the difference between coronavirus and SARS?
So they're both coronaviruses. Their genetic composition is different. They show, I believe, close to 80% identity. There are some differences. They both infect via the same receptor, in the sense they dock onto the same protein on our cells that then allows them to enter the cell and start replicating. It's too early to tell how the new virus is going to pan out. But one important difference that comes to mind is in the case of SARS, it was mostly the symptomatic individuals who were contagious, which really helped us suppress the outbreak and stop the numbers. So at the end of the tally, there were just over 8,000 people who had gotten infected and 744 people who died. from the infection, and it primarily infected a lot of people, unfortunately. And it primarily overwhelmed people who were the elderly, immunocompromised in some way, had other diseases to begin with, etc. The new virus is also primarily infecting the elderly and people who are vulnerable. And occasionally you hear about young people also succumbing to it, but the reports that I've read are also of healthcare providers who may be exposed to a higher than normal viral load, or perhaps are overworked and consequently stress their immune system, which we need in order to fight any infection. So with SARS, mostly the symptomatic individuals were contagious. What that helped us do is figure out, once we figured out what this infection was, we could do contact tracing and figure out who are all the people who came in contact with these symptomatic individuals. And then we could monitor them and tell them to seek help and isolate them as soon as they started showing symptoms. With the new virus, it's not so easy because also asymptomatic people have been contagious.
Wow. And so the quickest way between person to person is aerosol droplets. So
aerosol droplets.
Respiratory.
Respiratory. So if we have good cough etiquette and sneeze etiquette, and we trap those cough particles and sneeze particles, we really prevent these viruses from landing on other people's faces, or landing on surfaces that they can touch and then consequently touch their face or inhale these particles.
And can a mother that's expecting, can she transfer this onto her unborn child?
We don't know that yet. I imagine we'll know so much more about this virus before the year is out. Things like prevalence in the community, how many people actually had asymptomatic infection, how many had subclinical infections. That means they were exposed to it, had the infection, were spreading the virus, but they had no symptoms at all. So I imagine before the year is out, we will know the answer to all that.
You know, several news sources are reporting that states like Texas, their production, their manufacturing of masks are actually going scarce. In your view, does wearing a mask actually make a difference?
Well, it's a great question and something a lot of people want to know about. It depends on the kind of mask. It depends on the setting. It depends on where we are, what activity we are engaged in. A surgical mask, is a flimsy barrier, but it is some barrier. So when conditions are dire, we want to use everything at our disposal that can potentially stop us from getting this infection. Whereas the N95 mask, a respirator mask, is something that healthcare providers use. So we have loose fit, which anyone can use, and then we have fit tested, that is tested to your face to fit appropriately so that no aerosols seep in under the mask where you can inhale it. So those are the ones that healthcare providers use, and a little bit more sophisticated than those as well. The important thing to remember is if you are wearing a mask, it stops you from touching your face, certainly, right? So that is one thing. But if you're sick, then it also stops you from spreading just by talking, coughing, laughing, or just breathing. It stops you from putting out infectious aerosols into the air. So a good rule is, and CDC had this recommendation even prior to the new coronavirus, if you have fever and respiratory symptoms, you can minimize your chances of infecting others by wearing a face mask, provided, of course, it doesn't interfere with your breathing. But we are still at pretty low risk for coronavirus, human-to-human spread in this country. We haven't, other than the 2 close contacts of people who came back from high-risk areas, we haven't seen any cases where there hasn't been a risk factor. So that's good. That's a good thing for us. So we are still at pretty low risk. But if that risk were to change, and if we see human-to-human spread here, then all of us need to remember to engage in good cough and sneeze etiquette and to wash our hands before we touch our faces.
Well, I hope it stays low risk, because I cannot imagine this state, this country, people just walking around wearing masks. For us, that's very foreign. I know China, it's very common, but for us, it's so foreign. I would hate to see that. Are children and the elderly more at risk than the average?
So typically, for all infections, really, we have young children especially under the age of 5, the elderly, 65 and older, anyone who's immunocompromised, anyone who has a chronic condition like diabetes or heart issues or lung issues, they really are vulnerable to any and all infections. This new virus, from the cases, the fatalities that we see, the highest fatalities we see are in 80-plus population. There have been no fatalities at all under the age of 10 so far.
Wow.
So that's a good thing.
Yeah, I didn't know that.
So we don't, again, it's still kind of early to tell. I'm a big believer in prevention, so I really feel the more all of us stop these particles from going out into the air, the more we can protect the vulnerable individuals, which could include the elderly, the immunocompromised, people with chronic conditions, maybe pregnant women, maybe young children, right? But the new coronavirus is just one virus. There are so many others that start out looking like cold-like symptoms, looking like a cold, but it's far more deadly than a cold. Like measles, for instance. It starts out looking like a cold, but then it's one of the most deadly childhood rash and fever illnesses. Or influenza, for instance. It could look like a cold, but then it isn't. And so far, just this season alone, the 2019-2020 flu season, we've seen over 16,000 deaths just here in the United States.
Wow, very serious. Very serious. So if someone is showing symptoms, or they believe so, what should they do next?
So the symptoms are cold-like symptoms along with shortness of breath. So you have a fever, you have cough, and now you have shortness of breath, which implies to you that I'm having trouble breathing. And so something's, it depends what condition you have. If you have heart problems to begin with, that is not a good sign. If you have lung problems to begin with, that is not a good sign. So a good idea, if you have a mask, wear the mask and call where you're going. If you're going to see your healthcare provider, call them and let them know if you have a risk factor for coronavirus. If you just came back from a country and where you think you may have been exposed to coronavirus, then call your healthcare provider and let them know so they can be prepared. If you're calling 911, let them know so the EMS technician is prepared also to handle it appropriately.
Wow, doctor. All I can say is that, as you say, it's too early to tell, but we definitely have to stay safe.
Yes.
Whether through cough and sneeze etiquette, washing our hands, whatever it takes, and maybe even changing our travel plans. It's probably not in the best interest right now to visit some regions of the world.
Right. So the CDC is a great resource. If you see that right now it's level 3 for South Korea. I hadn't seen last night if there were any restrictions against Italy, but if you can just go cdc.gov/travel or just put CDC travel notice and do a Google search, it will tell you what their latest recommendations are. And I'm very confident in our public health system here. I think we do a lot of things right. So they would be a great resource for us to keep checking with.
So we need to stay abreast on where we should go and where we should not. Dr. Mayi, thank you so much for being here. You've been an awesome guest. You know, your voice on this subject, you know, is prevalent. It's important. And I think it's going to be very beneficial to our members, our agents, and the public at large. So thank you so much for being here. And our friends, that is our time. Thank you for joining us this morning on the official BDI podcast, el programa oficial de Best Doctors Insurance. Tune in every week for a new episode. Los episodios siguen cada semana. Connect with us anytime on social media, en las redes sociales, y en bestdoctorsinsurance.com. Have a great day, and don't text and drive.
Thank you.